Ears are an interesting part of facial anatomy. There's two groups of people we see. One group is a wide expanse of people whose ears stick out too far from the side of their heads. Generally, this starts to become apparent when kids are around age 3, 4, or 5, but typically they might have surgery at the age of 5 or 6 to bring the ears in closer to the sides of the head. The other major group that we see is individuals who have some sort of birth issue, and so they may come and see us to see if they can reform and reshape their ears to get them appearing like they think they should appear. Frequently, we perform this surgery mostly in people whose ears are projecting too far away from the head. We ideally like to see ears projecting out typically about 12 to 16 millimeters, and some ears may project as much as 30 to 40 millimeters. What we do is we freeze the ears behind, we trim out a little bit of skin, we may modify the cartilage either by altering form with sutures, or we may trim out some cartilage from the depths so that we can move the ears closer to the head. At the conclusion of the event, we wrap the head, and you want to stay wrapped for maybe 3 or 4 days, and then you come back, we take things off, we give you something to go home with to keep your ears close to the side of your head when you're sleeping. And most people can go out visually in public 3 or 4 days after surgery because the incisions are behind the ears and not visible. And the results are very gratifying, and people who've had protruding ears for years love the surgery. The commonest misconception is that both ears are exactly the same. They are not. It's very straightforward surgery, but one thing you have to bear in mind when we do so-called otoplasty surgery is one ear is not exactly the same as the other ear, and so post-operatively one may notice subtle nuances of one ear versus the other, but we can't reduplicate the right ear to the left ear exactly. But our goal is really to bring ears in or create a form that looks like a reasonable ear, and we're making the right and the left ear as equal as we can. If you think your ears are sticking out a little bit too far, we have the surgical means to improve this for you. Give the Younger Facial Surgery Center a call and we'll help you out.